Here I am arriving at work, and before I get out of the car, I put my mask on. And head on in. I work in a skilled nursing facility or nursing home as a physical therapist. All right, this is how I put my special N95 mask on. Take it out of the clean box.
And I work as a physical therapist in an outpatient setting. It's embedded in a cancer center. So all of my patients are cancer patients.
I found out at work on a Friday that there were quite a few patients in our skilled nursing facility or nursing home where I work. Mm-hmm. And essentially I had probably been exposed to the COVID virus. So I knew I needed to start isolating myself. I did come down with symptoms that Sunday. My hand here.
You can hug me. I'm all sanitized.
No.
No, I just spray on my feet.
See, they put mine empty there.
All right. Okay. I was more nervous when Jeff had it because his was lasting longer, and it went away for a little while and then came back.
So because of where both of us work, because we both work with high-risk people, Carrie with the elderly and me with elderly and oncology patients, we stayed out from work for 2 weeks. I'm not seeing any patients that have active COVID, but we have to be very, very cautious about bringing patients in because their immune systems are suppressed by their chemotherapy. You know, for someone whose immune system's already compromised, to get COVID could be fatal.
My coworkers assumed that they could get it any day, but you know, they care about the people that we're treating and they're not going away anywhere. But it is scary, you know, because they know that they're in a really risky place and they're thinking about their family and, you know, their kids and, you know, or their parents or whatever. And so it's kind of just a constant heaviness. As of Friday, I think we have 14 residents who have COVID, and we've had 7 staff members who've gotten it. Welcome, welcome.
I am making surgical masks for the emergency room at Valley Medical Center. I just recently retired and I wanted to be able to give back to them, and I was going to do masks, but I didn't have all the proper fabric and the filter system to go in there, and I wanted my peeps to feel protected and safe, so I decided to do surgical hats instead. Well, the emergency room is near and dear to my heart. I've worked there for 43 years and I just retired in December. So that's my first love, is the emergency room. And my mama heart wanted to be able to make sure my peeps were protected and safe. My heart wanted to say, yes, I'll be back there tomorrow. Just let me get my scrubs out and wash them and get ready. But in reality, I knew I couldn't go back because we are taking care of our 93-year-old mother. Plus, my husband has diabetes, and I don't want to subject him to any of that. And so I was really heartbroken because I really enjoyed being there with the people You know, I wanted to be able to be in the arena where I was fighting alongside of them. But at the same time, I know what I'm doing here at home is just as important.
So I'm currently a pre-med student, and so obviously like this is something that like I just had never thought about considering when you think about going into the medical field. Mostly like I'm thinking like, oh, like the sacrifice of time to go to medical school and all of that sort of thing. So my mom is a nurse at a rehabilitation center. There's a couple different ways she probably could have gotten it, but most likely just through working with people and, you know, people at the rehabilitation center going in and out of the hospital. For me, because like my mom has had cancer and she's like in one of the groups where it's like a little bit scary, like we didn't really entirely know whether her immune system was going to be fine when she got sick, and when it was a low-grade fever and like not as bad as I've heard it, it was a little bit more of a relief because like she was the person who was worried about like, oh, like if she gets it, it could be really bad. And this time of our lives, it's really clear that, you know, being in the medical profession can sometimes be putting your lives at risk for other people. I have kind of just like accepted that I probably am carrying the coronavirus. I mean, it definitely like it feels very weird to leave the house, even if it's just for a jog. Like it's always a thought in the back of my mind of like, oh my gosh, like what if I'm carrying it and what if I can give it to someone else? And then I think there's also the dilemma of like, we still need to get food. And so my dad is, you know, gone to the grocery store and we're trying to be as cautious, as careful as possible. But it's one of those things where it's like, okay, like we need food, but we also have very close contact with this virus.
I think my biggest fear really was that I could have infected some of my patients, because there was that day, like a day and a half, where I was asymptomatic, that probably was contagious, but didn't know because I didn't have a fever, I didn't have symptoms, and that was probably the scariest thing, was the potential that I could have harmed somebody.
Yeah.
And none of my patients have gotten sick, which I'm very, very thankful for that.
It will pass, you know, we will get to the other side and we'll look back, and I think it's important to think from that perspective and looking back, not wanting to have any regrets about I could have done more. I would much rather err on the side of being cautious than get to the other side and have been a little careless and have it cost somebody's life.
Sometimes it's hard to wrap your head around the fact that these things that you're asked to do really aren't about you, it's about other people.
Mm-hmm.
As humans, we're used to looking out for ourselves, and so I think that's a new concept for people to have to stop and think, am I putting someone else at risk by going out to the park or hanging out?
So just hearing about her work has always like already set an example to me of what it looks like to be selfless, especially in this pandemic. It's so crazy to see healthcare workers really laying their lives down for others, putting other people's safety above their own, putting other people's lives first. And I'm inspired just seeing like how our nation, you know, how we're responding to all of the healthcare workers. You know, we're so grateful for them now, but we should be so grateful for them all the time.
I am hoping that it'll bring back what's really important. People. The air we breathe. Just to be still. To enjoy each other.